Hi, my name's Michelle Gellis. I am an acupuncture physician practicing in Florida, and I teach facial and cosmetic acupuncture classes internationally. Can you go to the first slide? What I'll be speaking to you today about is treatments, ancillary treatments that you can add in to your facial acupuncture practice. A little bit about me. I am currently on faculty at Yosan University in the doctoral program. And before that, I taught at the Maryland University of Integrative Health as a clinic supervisor and adjunct faculty from 2003 to 2021. I have been teaching facial and cosmetic acupuncture classes since around 2005. So, when we're talking about ancillary services, the things that are included in that, and this is not a comprehensive list, but they can be facial cupping and guasha, and microneedling and red light therapy. So I'm going to talk just briefly about those topics and why you might want to add them and just a little bit about them. So first we have to think about our facial anatomy. So when we're doing cosmetic acupuncture, we're really working a little bit on the skin level, but and a little bit on the fascia, but more on the muscles and the different meridians that help to lift and tone the face itself. And we're also doing body treatment, so we're working on a deeper level to help the face to look better because we're working with all the organs. And as we get, I mean, if you think about the face, there's a lot of things that affect the way our face looks. Our facial expressions can affect the quality and the appearance of our face. As we get older, our tissues in our face can become more stiff and inflexible, and this can affect the appearance of our face. The retaining ligaments can loosen, things can sag. Also, the fat layers on our face can kind of move down and settle in different areas. And since fat is one of the things that gives our face its volume and it descends, really being able to work on the skin level, the muscle level, even the bone level can have the best effect on what your patients will notice during their cosmetic acupuncture treatments. So the first ancillary treatment is facial cupping. So facial cupping is designed to bring blood and qi and circulation to the skin and the muscles, just like cupping on the body. And it helps to stimulate the blood, get it into the tissues to help the tissues to be more healthy. And it also helps to stimulate collagen and elastin production, because when you're stimulating the blood circulation, it helps with the fibroblast production, which helps in the production of collagen and elastin. And those fibroblasts are what help to thicken the skin, because our skin thins as we get older, and it keeps our skin looking more youthful. So facial cupping can help to lift and tone the face, can help on the skin level, but it's really a way to get that good, healthy blood out to our skin. Facial cupping can help with the fine lines. It helps to relax any tight facial muscles, because what can happen is our facial muscles, through overuse, like our forehead muscles, the muscles around our lips, the orbicularis oris, they become tight. And then the skin that's over the muscle can become very wrinkled. So by relaxing the facial muscles, relaxing any fascia that has become stiff, it can help the way the skin looks. Also, facial cupping can move lymph through the face, and that means fluids and toxins down into the lymphatic system. And this can also help with issues like inflammation, like redness, such as rosacea, and facial cupping helps to strengthen the vascular integrity of the face, so you don't end up with as many of those little spider veins and a lot of the discoloration that you can get as you age. This is what facial cups look like. The ones that I like are the small rubber rubber ball with the glass bell cups. The glass is nice and smooth. It doesn't harbor bacteria. It can be cleaned easily. It glides really well on the face. And these small, specially designed cups are very easy to squeeze, unlike some of the other cups that you can purchase where it's really hard to squeeze them. This is a couple of slides taken from my facial cupping class. Facial cupping should start with a lymphatic drainage. You never want to drag the cup down the neck. Always suction and release. Then you go under the clavicle and into the lymphatic drainage area. My classes are designed for acupuncturists, but can be attended by other individuals as far as health professionals, as long as you understand where the landmarks are. So here's a slide where I'm showing opening the entry-exit points on the face, which can allow the greater movement of qi throughout the meridians. And this is an example of how you might suction a cup on an acupuncture point and then drag it up to another acupuncture point, up to gallbladder 2, to help to lift the jawline area, and then suction and releasing down the neck and into the lymphatic drainage area. Facial gua sha is really fabulous when you're dealing with facial fascia, and it can really sculpt the face. The tools that I like are shaped like this, and AccuLift Skincare has 2 tools and 2 cups that come in a kit, which I really like. But when you're looking at gua sha tools, you want ones, I like the ones that are multi-purpose, and jade is very much a part of our medicine. Jade is very tonifying to the skin, and when jade touches the skin, it creates an electromagnetic field, and it helps to bring the blood and the qi out to the skin. And it has, this particular tool has, as I mentioned, it's multi-purpose. It has corners for massaging different points. It has a nice flat edge when you're working around the temporalis. It has a smaller flat edge for under the jaw, and then this great notch here for working along the jawline and along the cheekbone. I had mentioned facial fascia. The face is the only place on our body where our muscle system is connected to our skin, which is why we can move the skin on our face. And this happens Through this SMAS layer, it is a superficial muscular aponeurotic system, which helps to amplify our expressions out to our skin, which allows us to move our lips and our forehead and our cheeks without moving any bones at all. And what can happen as we age is fascia, which is like this very fibrous layer. If you've ever looked at raw chicken or raw meat and you pull the meat away from the bone, that's what fascia is. And nerves can get trapped in between the muscle and the fascia, and it can prevent the signal from getting out to the muscle. And so our facial expressions cannot be illuminated, and it can also cause tightening and a pulling down of different areas of the face, especially in the cheeks, around the jaws. By doing guasha, you can help to release some of these fascial adhesions, which can cause entrapment. So here's just a quick cross section. You have the SMAS layer, and you have bone, and you have your masseter muscle, and you can see the nerve and how if the fascia is in the way, it can entrap the nerve. This is an example of doing facial gua sha. Here I'm using the tools underneath to help with the that kind of waddle people can get underneath their chin, really moving any stagnation, helping to tone the digastric muscles, and really work on that whole girdle that lifts up underneath the chin. And then in this bottom slide, I have this bottom photo. I'm using the U part of the tool to really sculpt along the jawline, help to break up any fascial adhesions. It's actually working on the bone level, and you can stimulate with the corners different acupuncture points as you go along. Gua sha is also really wonderful for releasing tension down the back of the neck, because everything that goes on in the back of the neck is going to affect the face. The back of the neck is connected to the face through the occipital frontalis muscle, and also the connections on the temporalis. All of these things work together to hold the face up, and by treating the back of the neck, you're also treating the front of the neck. A lot of people are getting, at young ages, lines in the front of their neck from keeping their head down. Their trapezius muscles are getting elongated. They're having a tightening in through the SCM and the platysma. And all of this can affect the way the neck ages, both in the back and the front, and the way the face ages, and can also affect headaches in the back and, well, all over the head, which can affect the way your face looks. If you're in pain and you're making that facial expression, eventually it will get lodged in your face. Next, I want to talk a little bit about microneedling. And microneedling is a big topic. It's a hot topic in cosmetic acupuncture. And this is a picture of a microneedling device. And so microneedling helps to stimulate collagen. It's very much a skin level treatment. It helps our body to produce its own collagen, and it also helps serum, any serum that you put on the face, to be absorbed. Some of the benefits of microneedling are, there's very little downtime, and it's low risk, very effective. It produces collagen naturally. You don't have to inject anything into the face. Can help with stretch marks, scars, acne scars, any sort of depressed scar. It can help with hair loss, and wonderful for neck wrinkles, lip wrinkles. It's comfortable, very little pain, and the results are very long lasting. Once you've done a series of treatments, the results can last up to 5 years. The way it works is when the microneedles go into the skin through the epidermis, the keratinocytes produce keratin, and this happens right in the base layer of the epidermis. And when you're microneedling, it helps to produce these fibroblasts, which meet up with venous and arterial capillaries, and they form together and they create new collagen. And collagen is what gives our skin its kind of its plumpness, its overall glow. Collagen is what keeps the skin smooth and helps it to snap back and to look more youthful and more healthy. Now, there's a lot of different types of microneedling devices. There are derma rollers, and these are great for at home. If you do it gently, you could do it every day, every other day, just to help your serums absorb, or it can be done more deeply, and then you would only want to do it every couple of weeks or less, depending on your age and your skin. I sometimes offer this as a service in my treatment space, but typically I sell derma rollers to my patients to use in between their cosmetic acupuncture treatments. Microneedle pens are wonderful as well, and they are electric devices. I do not recommend your patients do this at home. I recommend that they come into your treatment space and that you buy a good, high quality microneedling device that is at least 18,000 RPMs and has a cord and batteries, and then you get trained by someone who's registered with the American Acupuncture Council. AAC has been great. They have approved this AcuLift pen for use in the treatment room. And coming down here, this is a glass vial with gold needles on a little roller, and you can put serum right in this, and you can do microneedling with that. This is called a Hydra roller. As I mentioned, safety is really important, and if you can go to me, I'll show the difference between some of the... So there's different types of cartridges when you buy a microneedle pen. The best are the bayonet cartridges, and some of them have like a double locking system. Let me see if I can get this really close. Wait a minute. There we go. So this is like a double bayonet. Maybe I'm too close. And it has like it locks in two places, and then it has 2 holes on the outside to lock in to your microneedle pen. This has 12 needles, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 12 needles in it. And the AcuLift pen has a triple bayonet, and I don't know if you can see that. It has 3, trying to get this in the screen here. I don't know. There we go. It has a triple locking mechanism, and it also, so 3 bayonets instead of 2. And then it also has a 3 holes here. So it has 3 attachment points on the pen and 16 needles. And there's many different microneedle pens out there. I recommend that when you're choosing one, you do a little research and see which one works best for you. The anti-backflow is very important. You want a cartridge that, because the way the cartridges work is the needles go in and out, in and out, in and out. And when they're going in and out, you don't want the fluid to go back into the pen. You shouldn't have any bleeding, but you still don't want any sort of fluid getting into the pen. That's why the triple locking mechanism is really great. Okay, we are going to talk about red light therapy quickly, and this is another ancillary treatment that you can add on to your facial acupuncture treatments. And LED lights are wonderful. They've been used since I think that's like the 1960s or 70s. NASA started using them to help with wound healing and with different things with the astronauts. LED light interacts with the cells of our skin, and it helps them to produce new collagen and elastin, and is really great for things like acne scars and skin dyschromia or discoloration. And there's a picture of me laying under mine. So these little tiny lights, these light emitting diodes, it was the 1990s. I'm sorry, I said the 1960s. The 1990s, NASA began studying LED effects in promoting wound healing, and LED therapy was approved by the FDA for wound healing and for skin rejuvenation and helping tissues grow. So when we're talking about LED lights, they have several benefits. They can help with inflammation, bone healing, swelling, and neuropathy, and as I mentioned, wound healing. But for our purposes in our treatment room with cosmetic acupuncture, we really want to think about things like collagen production, wrinkles, hair regrowth, skin dyschromia, and tightening the skin. So the red light is the most powerful. This is where you get the skin rejuvenation, helps the oxygen content in the blood, and can help with pain that has to do with some superficial inflammation. The yellow light is great for increasing oxygen in the cell and helps with spots and removing pigment. The green light really will target the dark pigment, broken capillaries, sunspots, and like overall skin dyschromia, like melasma. The blue light is great for killing bacteria, so you can use it before you do a microneedling treatment, which is wonderful. But the blue light can be a little stimulating. People, they sit in front of the blue light. If they're depressed, it can really help your energy level. So if you start out with a blue light in your treatment room, it's nice to end on the red light, and that can help with the person's overall just relaxation. And then these particular lamps, you can do a combination of red and yellow, red and blue, or all 4 lights. So if you have any further questions, you can go to facialacupunctureclasses.com on Contact Us, or go to Facial Acupuncture on social and can either private message me, or I have a group on Facebook called Facial Acupuncture. So I hope you enjoyed today's talk, and I look forward to seeing you next time.